It's my great pleasure to be here as your alumni professor and share what I've been doing for the first 10 years of the professorship. And I hope at the end of it that you'll feel like your investment in me has been worth it. And as most things, I think, related to education, much of it, what I'm going to tell is going to be a people story. And I'm going to start off with a bit of a personal story and what's happened in my life since I first had since I first got the chair. So like many people in the audience, I've lost parents in the 10 years. I've gained a son-in-law and a daughter-in-law, so that's been all good. I've watched my daughter become a mother, a nurse, and a Columbia advanced practice nurse. And my daughter taught. Okay. And so it's been terrific. She graduated from the midwifery program a couple years ago. And I must do a shout out to the midwifery program because it was Tanya's experience in childbirth, which she was managed by Midwives of Manhattan. And thanks to Amanda and Laura and Sylvie, she just wanted to catch babies after that. And so that was really her driver for coming back to school. So when I was recruited, when I was recruited to Columbia, education-wise, I really wanted to do two things. I wanted to create an elite cadre of nurse researchers who were focused on informatics. And I wanted to also focus on what were the informatics skills and competencies that every nurse should have in this new healthcare environment. So I'm going to be focusing on primarily those two types of activities, and I'll also close with some things about some of the community partnerships, which Suzanne also mentioned. I think what you'll see throughout what I've been doing, I've really had a focus on underserved populations and health disparities, quality and safety, and then the application of informatics. So I want to start out talking about our G32 training program. So this is the first pre- and postdoctoral training in the school. It's explicitly called Reducing Health Disparities Through Informatics. One of our big goals was to recruit a well-qualified, diverse group of people. And this shows a group of the trainees over time. I don't have time to talk about them all, but I'm going to share the stories of a few people from both some of the early years and then more recently. So one of the people I want to talk about is Paddy Dikes. So she was the first informatics graduate of our program. She's done very well by herself, now a member of a fellow of the American Academy of Nursing. From early on, she was really focused on how she could use informatics to advance clinical practice and patient safety. She recently had a paper, a randomized controlled trial about falls prevention intervention that was published in JAMA. So she's done very, very well by her Columbia education. Another one of our early graduates was Leanne Curry. She's now a mid-career professional associate professor, has gone back to lead informatics from her position at the University of British Columbia, and I soon feel she will be the queen of nursing informatics in Canada before we know it. So once again, doing very well. We've also had one of the early years, I ended up having a group of 5 people graduate from the doctoral program at once. So I get this was probably around 2006. So you see the group there. I want to one of the people I want to highlight in the picture is Rose Lai, and she went back to Taiwan, and now she has a very high-level job in the Taiwanese government, and they're spending a lot of effort on health promotion and how can they use social media to promote the health of the population. So she's leading that effort for her country. So once again, I think the investment was good. I'll also point out Jackie Merrill, who's a public health, comes from a public health background. She's currently a member of our faculty. She uses social network and organizational network analysis methods to study health departments. One of the very exciting things about Jackie's work is she shows the network analyses back to the public health organizations, and they can see instances in which the communication and the relationships are not really what they should be. And as in one of the public health organizations that was really used in intervention, and she was actually able to show a change in a public health outcome because two groups of people, the STD people and someone else, weren't talking to each other, and after they did the intervention, they changed their organizational structure to more effectively communicate, and they actually decreased the chlamydia rate in their community. So I think that's a pretty awesome finding, and she's now a member of our faculty. Our two most recent doctoral graduates are Olivia Velez Benison and Sun Moohyun, and so I'm going to tell you a bit more about what these most recent people have done, and they're both postdoctoral fellows now here at Columbia. So Olivia focused on improving midwifery care in Ghana. And so she worked specifically through Columbia's Earth Institute and the Million Villages project to study the current practices within midwifery within Ghana, and then they developed an application called the M Clinic. So this is an application that midwives now use in Ghana to document the care, to do the different types of public health reporting that are required by the government in Ghana. Quite exciting from a dissertation was her application got rolled out to all of Ghana, and now they're doing Nigeria and I think one additional country. So you don't often have that level of impact in a single dissertation in particular. So we're very proud of her work that she's doing internationally. And the second person I wanted to highlight was Sun Moohyun, and she's working in the area of social media, and particularly in how can you apply data mining methods to Twitter. So I don't know how many of you, where are the tweeters in here? Do we have some people who tweet? So we have a few, so this might not make sense. But so Twitter is a short microblogging service. And so basically tweets are public unless you say otherwise, and you're able to download them and analyze them. So she was focused on wanting to use this as a potential physical activity intervention. So first she studied the question of who was talking to who about physical activity to see some of the different social networks that appeared in there. And then she also ended up applying a method developed at Stanford called sentiment analysis. And in this you actually apply computational methods to the text, and you can figure out which words are positively associated with physical activity and which words are negatively associated with it. And I don't think you would be horribly surprised that when you look at things like biking and hiking, there's lots of positive sentiments expressed with those. If you look at wood chopping, it's not such wood chopping and yard work have less positive sentiments associated with them. And you probably also would not be shocked when you look at the social networks, those poor wood choppers are the least networked. They appear to be either, they're not talking about chopping wood on Twitter anyway. And so we have a very vibrant doctoral program for those who are focusing in informatics. I listed the names of our current trainees, and one of the trainee whose picture is shown, Kenrick Cato, is actually one of the alumni scholars that you'll be hearing about later today. We've also had postdoctoral fellows. I just present the work of two, Dr. Roxana Maffei and Dr. Robert Lucero. Roxana is a Panamanian and U.S. She's particularly interested in shared decision-making in Latino populations, and so that's what she's studying during her time with us. And then Robert Lucero was a postdoctoral fellow in the program, and he's joined us as a faculty member a couple years ago. So that's, and the thing that I'll tell you about the first goal and wanting to build an elite cadre of nursing informatics scientists, I've told you some of the personal stories. I'll just give you one fact, and that is, according to bibliographic measures, that is, who publishes the most, we're number one in the world in nursing informatics, so I'm very pleased. So I'd say that goal was achieved. So we're number one in nursing informatics. We're actually number 3 in medical informatics. So we've done very well by our medical informatics work. But next I want to talk about a little thing about the second goal, which was more focused on what should every nurse know about informatics. So we've been very fortunate to be funded for 9 years from HRSA, in which we could focus on integrating informatics competencies and patient safety competencies into our curriculum. And this has been at every level through the entry to practice program. At the master's level, we had some special work that we did with the anesthesia faculty. We also have coursework that we do at the DNP level as well. And we've been able to show through these different efforts that we are putting out graduates at all levels who are, of course, more than competent in both informatics and patient safety. We've also developed a number of tools that the students use along the way. One of the unusual things we were able to do was to, at one point in our program, when there first were personal digital assistants, we got the first 100 of some version off the pipeline or assembly line, which wasn't exactly the best thing to do because there was about a 20% device rate. But we were able to have students document their encounters on the PDA during the course of their program and being able to look at that data, advance their critical thinking. But one of the interesting things that we did was we were able to build on top of that work and get money from the National Institute of Nursing Research to do a randomized controlled trial of putting decision support on top of what had been our foundational student application. And so we focused on 3 areas of depression, smoking cessation, and obesity. And this is just showing a little bit of application. This was in the old days before there were fancy Apple apps, but the people would screen for obesity. The computer would do some calculations. It would generate their, in this instance, their obesity-related diagnosis. And then the NP student would be able to create a plan of care that would be tailored to the particular condition, in this instance, to the obesity. What we're able to show from this particular work, and students, our sample for this was more than 30,000 encounters, we're able to show that it decreased misdiagnoses, thinking in the area of obesity. And when we looked at the difference in the number of obesity diagnoses, depression diagnoses, and smoking cessation related diagnoses, we saw greater in the intervention group in all instances. And then we also saw more interventions only in 2 of the groups. It was most interesting actually in the area of pediatric depression. It had the lowest screening rate, but among the kids who were screened, we actually had a 20% rate of at risk for depressive symptoms, and actually a 4% were noted to be at risk for suicidality. So that really picked up some interesting things in the trial. We've published tons about it if you're particularly interested in it. I just show, the only thing I want you to see on this slide is that they're blurbs of red. And that's just showing that in addition to having this thing which was focused on our clinical program, that we actually had 3 doctoral dissertations that came from this particular study as well, and that's what the red represents, and several additional publications as well. I next want to focus on the Center for Evidence-Based Practice in the Underserved. So this was, although the school has had additional NIH-funded research centers since this time. This was the first center in the school, and it was the first thing I got asked to do when I showed up on July 1st. It was just like, guess what, you're gonna write our center application. So it was an amazing way to learn about the fabulous work that was being done in the school. And so we've been a center for 5 years now, and you can see that we funded a lot of different faculty to do research. I want to just share 3 of the projects that are currently going on now. One is the work of Rebecca Schnell, and she's actually was the second graduate of our PhD program, and soon assistant professor with us as of July 1st. And her area is symptom management in HIV/AIDS. So she's developed and is testing in a randomized controlled trial a system that allows those living with HIV/AIDS to pick out who they want their avatar to be, to go through a symptom management assessment process and then get a set of tailored interventions related to their particular condition. Arlene Small, who was here earlier, I don't know if she's still here, but anyway, okay, there she is in the back. So Arlene is an expert in diabetes in adolescents, so she's developing an application that's focused on adolescents who are newly diagnosed with type 1 diabetes and are on the insulin pump. And this application is really focused on helping them to problem solve and make better decisions related to their diabetes. And once again, it will be tested in a clinical study. In the third study, which is being led by Robert Lucero, it's focused on trying to reduce falls risk in community-dwelling elders, both English and Spanish. And I personally have fallen in recent times, but I don't live in the neighborhood, so I meet the elderly criterion for the study, but I fell in Brooklyn, and I live on the Upper West Side, so I didn't, but one of the big trends, and I'm not sure if any of you are seeing it in where you go for your health care, but one of the big trends is the notion of having a personal health record that both allows you to view your clinical record, but you might also be able to add things in. So New York Presbyterian Hospital's clinical personal health record is called mynyp.org. And if you get care here, it's easy to get access to it. So the basic idea behind this was that Robert led the work on developing the application both in English and Spanish, but instead of having it as a standalone application, it's been integrated into mynyp.org. That means it can be more broadly accessible after the clinical trial is done with it. And this is just showing some of the different components of it, and it's very focused on helping elders such as myself get information on preventing future falls, and also to be able to have things such as calendaring function and those types of things. One of the things that Suzanne mentioned was that we've also wanted to make sure that some of our efforts were very community facing. And so one of the things that through Obama's ERA funding, we were able to get some additional funding to the center that helped us to offer an educational program for kids in the neighborhood for 2 summers. And so this is working with Gregorio Luperon High School, which is a math and science high school for Latino immigrants. And so because the issues of obesity and low physical activity are so predominant in this population, they kind of show up as freshmen from the Dominican Republic, and they're quite lean, and by the time they live in our neighborhood, they eat the food around here. And for the females, their mothers don't let them and fathers don't let them out after dark to exercise. They end up really getting into a very unhappy and unhealthy lifestyle. So the idea we had was to work with the kids to design an application that would be on Facebook and could help them promote their physical activity. So this was our design team, as you can see, looking like typical teenagers. And so we worked with them during the summer to do a couple of things. One is just to help them take full advantage of the resources of Columbia University, because one of the things that happens to these kids is they can be absolutely stars in the high school, and then they just plateau, and they don't reach their career goals. And so by having them in contact with our faculty and seeing great role models for really going the distance and meeting people that can help write them great letters to get into the college of their choice, where really, it's hard for me to talk about it because without fail, it has ended up being so life-changing from them. And we have the testimonials that I won't read any because then I would really start crying again. So they learned, they worked in the sim lab. They actually practiced intubating the dummies. Everybody got CPR certified, which makes it safer for us in the neighborhood. If we go down, but then also they worked on developing the application, which we called Facebook Pals. And so this is just showing some of the screens of the application, being able to generate a physical activity plan. We had them do lots of videos they interviewed baseball players, they did dancing lessons, and videotaped those to put up on Facebook as well. And then one of the other aspects of the application they did was the notion of challenges, because one of the aspects of Facebook is you're able to challenge someone else to a particular task. So this is the idea of physical activity challenges. I want to spend a few minutes talking about two of the projects that I'm very involved in at the moment. And one of the things that's happening in terms of just science in general is the notion of comparative effectiveness research, and particularly how can we use existing data to do different types of studies instead of always have everything being new data collection for a randomized control trial. So I am leading a project called the Washington Heights Inwood Informatics Infrastructure for Comparative Effectiveness Research. It's funded by the Agency for Healthcare Research and Policy. It is a $9 million grant. So it's a big one. And the idea behind this is to gain a comprehensive understanding of the Washington Heights Inwood population, to facilitate research with the population, and to be able to reuse the infrastructure for comparative effectiveness research. So just to remind you where we are, this is Washington Heights Inwood. We focus on 5 particular zip codes. And the importance of us focusing on these 5 zip codes is they are zip codes which, when we compare them to the rest of New York City, the people in our neighborhood are significantly less healthy, higher rates of obesity, low levels of physical activity, lots of depression going on, and those kinds of things. The other thing that makes this a very unique opportunity is we can think about NYP as a quaternary medical center, but in fact, for the people in our neighborhood, it is their community hospital. So that really affords us the opportunity to bring together data about the community and their health behaviors and other types of things going on with them, with data from our clinical enterprise. So this project involves all the schools at Columbia University Medical Center, as well as our faculty practice organization, Columbia Doctors, which includes our own CAPNA, New York Presbyterian Hospital, also Visiting Nurse Services of New York, Isabella, which is a residential a skilled nursing facility, community-based organizations, and also the community. So I want to particularly talk, there's a number of different components, but I want to particularly talk about just 2 aspects of them in the time that I have left. One is about the community survey, and this is really quite exciting because we're gathering data from about 8,500 people in the community, and the survey takes about an hour. So we collect health behaviors, we collect things on nutrition, we collect physical activity, we do their blood pressure. We actually also have just started to collect both saliva and dried blood spots, so we can do things with genetics. We also can look at things like cortisol. And those types of things. So we look at health literacy because we know it's a major issue in the community, but we're going to be able to quantify it in a very big way through this particular survey. So we're interviewing some people directly in the community, some people in our Columbia Community Partnership for Health, which is our outreach center, and then also people in our ambulatory care network. From a research perspective, one of the most important things is those data are being pulled together into a research data warehouse, which makes it possible for nurse scientists and other researchers to have access to these rich sources of data, of course going through the proper HIPAA, the proper data governance, the proper IRB, and that kind of thing. But I don't think there's any place that will have this parallel, like deep knowledge of its community, because we'll have the community data plus the hospital data, as well as potentially the genetics and some other data on these people. And so one of the team that's led by Adam Wilcox in DBMI is building a user interface that will facilitate researcher access to the data. Where I'm going with this is I feel that we need to also have an interface that allows the community members who participated in the community organizations to see the data. And if they have issues with depression or obesity, et cetera, to be able to use different types of informatic methods to help them get further information about that or to refer them appropriately. So that's kind of one of the grants that I'm working on at the moment. Another thing that one of the other big issues, big trends in the last, it's been 6 years, has been this notion of having these centers for clinical and translational science research, or we call them CTSAs. And so Columbia was in the first round, and one of the things that we were fairly unique in the first round in that we had a very strong nursing presence with Nancy Ream, Elaine Larson, and I all being leaders within Columbia's CTSA, which we call the Irving Institute for Clinical and Translational Research. One of the things that the resource which I lead, which is called the Biomedical Informatics resource, is we're developing is, and you should use this, it's easy enough to find. If you want to find any faculty member at Columbia, you can go into this system and you can search us. You can see what publications we have, what grants we have, and it also shows our contact info. So and it's open to the world. So we're pleased to say that. And going back, I've mentioned social network analysis of this media a few times, but one of the things we're able to do besides just providing lists of grants and publications, we're able to see who we're networked with visually. And so this is my publication network, and on this you see I'm linked with another investigator over a particular paper focused on a nursing informatics research agenda. That person happens to be Elaine Larson. So it's a way we can see how our networks change over time, and this is just the network for the WISER project. Once again, so this has been kind of a fast track through the last 10 years. It felt short to me. It may have felt long to you. So I understand that. But just although I started late, I'm finishing on time, but I want to leave you just with a few closing thoughts that are kind of what I'm thinking about a lot. And that is, we still do have issues with significant health disparities. Quality of care and patient safety are suboptimal in the US. Lots of data supports that. I believe that it's vital that informatics is part of the solution. And the approach we've taken in the school is making sure that we have a multifaceted approach, that we make sure that our students have informatics competencies and can integrate informatics tools into their practice. We're preparing nurse scientists who can lead interdisciplinary informatics research programs to help move the science of using informatics to reduce health disparities. We have focused on having a research center of excellence, and we have also focused on taking advantage of the rich interdisciplinary environment that is the Columbia we all know and love, and then also, importantly, really investing in our community. And so I think there's incredible opportunities for the next decade. I've enjoyed the first decade. It's the alumni professorship. As far as I know, it doesn't end now, but But anyway, so it's just my pleasure to share some of my activities for the last decade. And I hope that you'll feel like your investment in me has been worth it. Thank you.